Hi, this is Dr. Jay Davidson from drjdavidson.com. Welcome to another interview on the Mitochondrial Summit. I'm with Dr. Matt Doduro. Welcome to the summit.
Thank you, sir. Pleasure to be here.
So give our listeners a little background because you're going to be talking about tissue regeneration technology specifically, but obviously this is the Mitochondria Summit. So what's your background?
Well, I'm a chiropractor for the last 25 years. I've worked in private practice. I also taught at Life University from 2007 to 2009. The last 10 years actively working with Neuropathy Treatment Centers of America, and I am the clinic director for ATL Pain Institute. So our focus has really been on working with diabetic, chemo-induced, and peripheral neuropathy patients.
Where does mitochondria fit in with neuropathy?
Well, as you know, as part of all of aging process, your mitochondrial health is so important. But specifically with neuropathies, we see a decline in the mitochondria. So the mitochondria are not actually able to repair and regenerate normally. And for 10 years, we've used near-infrared or polychromatic lights to help improve blood supply and decrease pain. But we also think that those polychromatic lights are actually activating the mitochondria to some extent as well.
Okay. So when did the tissue regeneration technology come into the mix for you?
It was about 2.5 years ago.
Okay.
And what we noticed was we had a CFO that was an early investor into the company, and he would come by my clinic and he said, you know, I've got this technology. I think it will really help your diabetic patients. And I hear that a lot. So, you know, after a couple of weeks of him prodding me, I went up to the Woodstock, Georgia, where the headquarters was, and I got to experience it for myself. And I used it first on myself. I've had an old wrist injury. I had a patient about 12 years ago, 350 pounds, that fell off the table. I grabbed him, dislocated my arm, and tore my labrum and damaged my ligaments in my wrist.
Ooh.
So had the surgery, one on my shoulder, one on my wrist, and my shoulder's been good, 99% better. But I've had this chronic issue with my wrist. So if I ride my bike, if I'm mowing the lawn, playing golf, it would hurt. And it would take 3 or 4 days for the swelling to go down. So as part of my tour, I got a treatment. And they said, what's hurting you? I said, oh, my wrist. So I had the treatment done. Mm-hmm. And I felt pretty good. It was painful, a little painful while it was going on. But the next day I played in a charity golf event. And normally I'd have to ice my wrist and be kind of down for 2 or 3 days. No problem. I actually went to the range the next day. And I had 3 different treatments over 3 weeks. And it was like 90% better after 10 or 11 years. So I was sold. And I quickly signed up to go to an international symposium, Shockwave Symposium in San Sebastian, Spain in June of 2017. There, I really got to meet orthopedists, urologists, neurologists from all over the world that were using this technology. And, you know, in the rest of the world, medicine is not as an industry. And these doctors are using whatever is most cost-effective, least invasive first.
Okay. Well, I'm really excited to hear about all the details of this technology, and more importantly, excited to share with the listener because one of my really good friends, who's also your friend, Dr. Isaac Jones.
That's right.
He was going up for a layup and got pushed in the back and basically ripped apart his knee.
Yeah.
I think it was PCL, MCL, meniscus.
ACL as well.
ACL.
Grade 3 tear, yes.
Grade 3, which essentially when you're doing a drawer test, it's just...
Yeah, he had no stability in there.
And the orthopedic, if I'm saying the words right for Dr. Jones, said, this is one of the worst I've seen. You have to have surgery.
He did recommend surgery, that's correct.
And he messaged a lot of people, and he's like, guys, what can I do? Is there any other options besides surgery? And some time went by. Next thing you know, I'm seeing him move around, run around, and I'm like, so no surgery. He's like, dude, no, you gotta meet Dr. Matt. Like, this technology is amazing. I'm like, okay, because Isaac's always a pretty happy, chipper guy and positive. So I'm like, let's really hear about this. And so he introduced us. Mm-hmm. You sent me research. I started reading through it. I'm like, this seems amazing. Because I've had knee surgery before. I've had prolotherapy where they inject essentially saline. I've had PRP where they draw the blood out, concentrate the platelets, inject that. And then now the new kind of up and coming therapy, if you will, is stem cell, which I kind of look at prolo, PRP, stem cell. Mm-hmm. And stem cell therapy is usually, $3,000, $5,000, maybe $8,000 a treatment. And then seeing this technology, I'm like, wait a minute. So this stimulates your own stem cells and triggers and targets the area I need to know more about. And that's kind of what opened my eyes up. And I want you to open up the listeners' eyes that, you know what, there's some really cool technology that's been created that can help the body.
You're absolutely right. And it is a tissue regeneration technology. It's TRT. And it's been cleared by the FDA to help decrease pain, improve circulation. And what we're seeing is it actually activates your own resident stem cells, which have been lying dormant and just come out after the injury. And it's an attractant for so many other helper cells. But we also see VEGF, vasoendothelial growth factor, released, and which allows nitric oxide to come out of the endothelial tissue and allows vasodilation. So you have like this 300% increase in blood supply within a couple hours of the treatment. And for our viewers, anywhere there's pain, there's poor blood circulation or damage to that vascular bundle. So pain equals poor blood supply. This technology is really like the Star Trek scanner. I mean, if you remember from back in the day when Dr. McCoy, Bones, would run this scanner over the body, and because of the biofeedback component, the patient can tell us exactly where that pain is.
Okay.
So a good way to look at it is if you run it over normal tissue, no pain. As soon as you get to a damaged area or injured area, your body is like, whoa, right there. So not only does it diagnose, but then you can start the treatment as well. So it's attracted for all these other cytokines and exosomes, and within 8 to 10 weeks, you have your own stem cells migrating to that injured area.
So define what tissue means. Like, what does that encompass when you say tissue regeneration technology? What encompasses tissue?
Well, we have cardiac tissue, we have skeletal tissue, which is bone, and then we have connective tissue. So this tool may be the most versatile device that we've seen in the last 25 years because we're working on wound therapy. There's actually an antimicrobial effect as well. So we've used it on infected dog bites. We've used it on burns. Had a terrible diabetic neuropathy wound that we worked with a patient that was at Piedmont Hospital. And we actually documented over 8 weeks his repair of tissue, which never scarred. And in true healing, in angiogenesis, which is the formation of new blood pathways, you'll usually get a scab over that. If you pull that scab off, underneath that is the angiogenesis. So this has a antibacterial effect as well. And it's really exciting. My dog got bit by a copperhead snake last Labor Day, a year ago. And we were at the veterinarian's hospital, and they thought because of the necrotizing fasciitis that they were going to have to amputate a couple of his little digits. And I talked to our medical director, and he was like, do they have shockwave therapy? And I'm like, no. He goes, take him home and start doing the shockwave therapy. We did basically 3-minute treatment for once a day for 3 days, and we killed all that venom. So this has been used in veterinarian medicine for the last 30 years. And almost every horse that ran in the Kentucky Derby had this technology used on them. So it's called extracorporeal shockwave therapy, meaning outside of the skin. And it uses heat, light, electrohydraulically produced sound waves that penetrate through your body and create a reaction which triggers our own natural healing response.
So when I see the machine, just for the listener, I mean, it kind of looks like an ultrasound. You put like the gel on and it's got like this big head thing and you're kind of moving it around. and then there's a big box basically that it's connected to, essentially, right?
Correct. And this is based on the actual lithotripsy, which is the big machine you see in hospitals that break up kidney stones. And that technology's been around for about 40 years. And believe it or not, it's an 85% success rate at breaking up those kidney stones.
Wow.
So again, light, heat, and electrohydraulically produce sound waves. Now, the big devices in the hospitals are over $500,000, and they're called high-intensity focused shock waves. This is a mobile lithotripsy, which is low intensity, and the applicator is unfocused, meaning all the head, whatever it touches the surface, is getting treatment area.
Okay.
And TRT, the tissue regeneration technology, has over 43 patents with this device here in the States.
So this was based on, I mean, where did the jump come from? Okay, we're breaking up kidney stones in a hospital to now, like, oh, I just fixed my wrist with it.
That's a great question. You know, it must have been the urologist because this is their baby. And they must have been turning it down to certain levels and said, hey, you know, I've got this sprained ankle. And they used it and they got some inflammation relief. And the pain went down. And for a while, for years, we actually thought we had to have pain while treatment. And because we thought that would trigger the biological effects. But it's not. We use the biofeedback to find where the area of pain is, and then we can turn it down to a lower intensity. But even at 2 and 3 millijoules per millimeter of energy, we're still getting a biological response. So, I mean, that's how I think. It's just really the urologist. It kind of boomed from there. There's a wonderful researcher, Dr. Thomas Liu, out of University of California, San Francisco. In 2018 in Lisbon, an international sexual symposium, he stated that every urologist would have to have this device in the next 2 to 3 years, or their clinic would be antiquated. And so it's really been a buzz within the urology community. I'm actually one of the first chiropractors to bring this technology to our profession and to our patients. And I've actually patented the use of this device with the polychromatic lights to treat chemo, diabetic, and peripheral neuropathy.
Wow. Yeah, I know you're forerunning this and spreading the word about this. And, you know, to some degree, when I heard about it, I'm like, it seems a little too good to be true. And I'm like, Isaac, how, you know, the guy that blew his knee out, how's your knee doing? It's perfect. It's like brand new. No surgery. I'm just thinking, wait a minute. So our bodies have, because we're taught this in chiropractic school, our bodies have this innate ability to heal itself. But yet, after surgery, after an injury, it's like things aren't always the same. But this really has the ability to change that.
You're right, and it's actually has a smart modulation. So, for instance, in 90% of the cases we're working on, we're looking to decrease inflammation and swelling and decrease that pain. But in some instances, like with a non-healing fracture in the lower extremity, it will actually turn on the inflammation. So it has this smart modulation. And in Austria, they've been using this in the work comp system for 10 years. So we're getting wonderful results. And Austria might have the best healthcare system in the world, because if you're injured there, they will fly you anywhere in the world to get a treatment done if they don't offer it in Austria. So they were having all these workers that were traveling to Germany to have this treatment done for especially like non-healing fractures. And after a while, the director of the Austrian work comp system said, okay, I want to demo this for 3 months. And he gave it to this one young doctor and he said, you've got 3 months to prove that this thing is a sham, right? Because they were sick of paying for all this travel and treatment for all these other patients. And after about 6 weeks, he came to his director and was like, I can't live without this thing. And that's kind of the way I feel in my clinic now. It's given us these super healing powers that just to help accelerate that healing in the patient. And I mean, every week we have another wonderful story of patients coming up. And I'm getting patients that came from Panama, New York City, Florida, traveling to Atlanta to get this therapy done. And it's really my goal, not just to treat people in Atlanta, but get this in every major city in the U.S.
Yeah, well, and that's one of the reasons I wanted to interview you for the summit, was to get this out there, because you call it tissue regeneration technology, but I mean, it's like a stem cell machine.
That's right.
So as I look at stem cell therapy, you know, there's things with it of, are you going to harvest the stem cells from your hip bone? Are you going to take it from umbilical cord blood? You know, with that. So it's kind of that decision of what you do. Then it's injecting it. But inevitably, when you inject stem cells into, let's say I've, you know, had my knee injury that I got, you know, or surgery almost 20 years ago, what actually activates the stem cells on a stem cell injection? Because my thought is that I thought it was like the exosomes, but when you're doing a stem cell injection, they're not necessarily being activated. So do you know the details for us on that?
Yeah, that's a good question. It really is triggering that exosomes, increased circulation in that. And we're seeing a lot of stem cell clinics and regenerative medicine clinics adopting this tool because, first off, it's going to help increase their outcomes, improve their outcomes. You need less visits, less treatments. And what we're finding is, remember I told you it's almost like a diagnostic tool. So especially with knees and shoulders and when people are getting stem cells injected, some of these clinics, I'm teaching them that as you run it over, you have to document where those really pinpoint pain levels are. And that's where they actually want to put the stem cells. I think it creates a wonderful environment for the stem cells to come to that area. Okay. So it's calling for all these other cytokines and anti-inflammatories to come here anyways. And the cool thing is, like with joint replacements, that you really can't do stem cells in there. But we can use this device over partial and full joint replacements. And again, it's reducing inflammation, improving swelling, improving circulation, I'm sorry.
Okay, interesting. I mean, so a traditional stem cell therapy, you're kind of relying off of the practitioner's ability to get the needle to where it needs to go. This machine, just based on how you feel, you know, oh, right there. And that's, I mean, seems a lot more pinpoint.
It is. And I do think like PRP was used in combination with this device in Europe about 10 years ago, but we've seen them just moving towards less invasive, less costs, and really focus on getting the best outcomes. And really, when you look at it in the algorithm, you don't want to start with the most expensive thing that's $5,000 or of stem cells, or an epidural, or going in and burning the radial nerves, or it's just not natural. You need those things, and we do have a patent for the elongation of neurotissue or peripheral nerve regeneration, and that's why I was so excited to bring this for our patients that have diabetic and peripheral neuropathy. Because even though it's a nerve issue, the underlying issue is really a blood flow issue. So if we can increase that blood flow, we can really change the environment and allow those sensory nerves to rehabilitate and get stronger.
So tissue, you're looking at bone, tendon, ligament, cartilage, muscle, and then you just said nerve. I mean, that's right. The gamut. I mean, really.
And there is a cardiac regeneration technology as well, and that is still in pilot studies in Europe, but they have used it during open heart surgery on patients who've had heart attacks and scar tissue, and they're getting near normal injection fractions afterwards. So this is really an exciting new area of medicine.
Yeah, it seems like it. And again, it almost seems like it's too good to be true, but it's, when I had PRP, that is a painful process. Like, you get the injections, you get the blood drawn, spin it out, you get the injections, and it swells up. Can't even, obviously when I'm getting it done with my knee, or had it done with my knee, it swells up. It's pretty intense. And stem cells are even, another level to that. When somebody has a treatment with the TRT technology, what's the rest period? How much pain, swelling afterward? Like, what's it like?
So it's near immediate relief. That's pretty wild. By the end of the first treatment, patients will have less discomfort, they'll have improved range of motion, and that initial response lasts for about 15 hours. We like to piggyback the treatments once a week for 3 to 5 weeks. So it's not like they have to come in every day. And there was a great study that looked at cold laser versus extracorporeal shockwave therapy. They had 30 patients with the same diagnosis. Those patients came 5 times a week for 3 weeks, so they had 15 visits with a cold laser. The other patients, the other 30, they came in once a week for 3 weeks. The results were pretty astonishing because the shockwave therapy patients had better outcomes, less pain, and with less visits. So, I mean, again, it pairs so well with our profession because we're really trying to activate that innate healing ability. And this gives us something for especially our older patients, right? Mitochondrial health. For every year we're on this earth, every birthday, those mitochondria will get a little weaker and they're not repairing and regenerating. And I really feel that our patients they've found it's almost an anti-aging or a performance enhancing device because it helps boost energy within that cell and just gets the body working at a higher level. So most of our patients that we work with are about 68 years old. And some of those patients, we can assume that their mitochondria are working at an anaerobic type level, where the mitochondria are only producing ADP, adenine diphosphate.
Okay.
We really feel that this technology is helping activate the mitochondria and almost giving it a spark so that now they're working at an aerobic state again, and now the production of ATP goes way up. And we've seen that in numerous research articles and some of our early studies that really laid that foundation.
Yeah, I've seen those research articles of the pictures of looking at the mitochondria before and after, and it's like there's life in the mitochondria.
It almost looks like they've been highlighted, and very similar to what you hear with ozone therapy.
Okay.
So, but getting back to the racehorses, so they made it illegal now for some horses to have this treatment done 3 to 5 days prior to a race because of that performance enhancing ability. So, I mean, who wouldn't want that special sauce? I don't care if you're playing pickleball or golf or you're just an active senior. This gives you that secret sauce to get that skip back in your step. And that's what we're seeing. Like patients after treatments are like, wow, my feet feel lighter or my knee feels better. And we're working at getting people away from walkers and canes and improving their mobility. You know, your balance, 60% of your balance comes from your feet. So our main focus in the treatment of diabetic neuropathy is helping with the feet. So not only we're seeing these patients decrease their pain, but they're also improving their balance and their mobility. So it's exciting to kind of see them regain their mobility.
Yeah, totally. I mean, going back to you said you can kind of use it to diagnose and treat at the same time. So what if somebody says, and I don't know a person where there's not some type of injury that's happened in their life, but let's say, well, I don't really have an injury, but I just want to make sure that I have optimal performance. Can this be used to detect things early on before you blow a shoulder out or a knee out?
Great question. The Cleveland Indians just bought a second machine, and they are screening their players once a month. Doesn't matter if they have any pain. This is true prevention. I mean, they're getting in there, and they can turn up the energy to go a little deeper, but they can scan the shoulders, the elbows, the wrists, the knees, the feet, the ankle. I mean, just think about it. These are multi-million-dollar athletes, and if they're down for a couple days, that team is losing out on their productivity. So we're seeing New York Knicks use it, New York Nets, Cleveland Indians, Chicago Cubs, Memphis Grizzlies, the LA Lakers just bought one.
Wow.
So Dr. O'Malley, who's really our specialist out of New York City, he has 2 of these devices. I mean, he is been using this, and he's doing some wonderful work. He's treated over 200 professional NBA players.
Wow. Well, I'm just thinking, even if somebody's not an elite athlete making millions and, like every second counts for performance, how many people have chronic illness and they just aren't going to start exercising because of some injury or that could actually be changed and healed?
Well, I think that's why it pairs with every function in healthcare. I mean, it might be the most versatile device. We've used this on every organ in the body.
What about ages?
So you said the question, what if we don't have any problems? We can actually use reflexology point in the feet, in the hands, and just do a regenerative type of therapy. And as we scan the feet, I'm telling you, I'll find something on you when we do your feet. It's like 9 out of 10 times. I mean, think about it. I'm 53 years old, and I've probably put over 60,000 miles on these feet. There's no, tire rotation for your feet. But with this technology, I mean, it will bring some life back into your feet and your body.
Because obviously your research has shown that this impacts the mitochondria and kicks the function up. What's the longevity, or how long? Is it for just 30 minutes after and then until your next treatment? How does that work?
So short-term effects, it decreases pain, improves circulation, decreases swelling.
Okay.
Long-term, that 8 to 10 weeks, we see the migration of the stem cells. So the true healing is 2.5 to 3 months later. By 12 weeks, we're seeing the neovascularization or new blood pathways that are forming. So it's like with my wrist, I had 3 treatments, once a week for 3 weeks, and didn't get another treatment for 14 months. And I had the device in my clinic. I mean, I felt that good. And I play golf a lot now. And I'm not that good, but I still like going out and really, playing some wonderful courses and just enjoying that sport. So it was a sport that I didn't think I could do anymore, without pain. Same thing with biking. I mean, I love to bike, but I just couldn't be in that extended position. So, yeah, I mean, every person's different, obviously, but we're seeing 3 to 5 treatments to get the maximum production of that stem cell for that patient.
That's what's so exciting, because it seems like stem cells are all the rage, but there's cost, there's pain associated with it. This just seems like a lot better route, safer, less costly too. Treatment's maybe $300 to $500, and now a machine. Not like a typical person's going to buy a machine. Does it have to be a healthcare professional buy one?
No, we're having professional athletes buy them.
Okay.
But, we're seeing the range of cost is anywhere from $75 to $300 for a treatment.
Okay.
But, it's a fraction of the cost. Stem cells may be the future of medicine, but they're not the future for the average Joe down the street. Not everyone can spend $5,000 per joint, especially when you have to do 2 knees and your back. That's a lot of money. And it's still a crapshoot, right? We don't know. It's not 90% success rate. So not everybody is going to roll the dice on this. This is a wonderful way to activate that natural biological healing response and getting the most out of your own body and your own stem cells. So why wouldn't you want to try it?
So this can be used for old injuries. It can be used for new injuries, like our friend Isaac. It can be used for wounds. You said it's got an antimicrobial effect, or just like with your dog with the
snake bite.
Snake bite.
We've used it on infected dog bites, a military person, and that's exciting that it has so many different functions. It's so versatile, and we really don't see a lot of side effects with it. I mean, we're not going to use it over an active form of cancer. We're not going to use it on skin cancer. We're not going to use it on pregnant females. And the only thing I've seen is that if someone's had a cortisone injection within the last 3 or 4 weeks, we should not do this treatment.
Okay.
And for some reason, after the cortisone injection, it doesn't all go into that joint. It lays dormant in the tissue. And for some reason, when we use the applicator, it activates that issue and may cause a little more discomfort. So once 3 or 4 weeks past a cortisone injection, then you can actually use this.
Okay, so that's not actually too many cases to not use it.
That's right. And we've used it on the eye, on the hands, a male's testicles. I mean, there's some wonderful urologists in the sexual health industry that are really incorporating this. Dr. Goldstein in San Diego, he's one of the premier doctors in the country. We now have one at Baylor University, Mayo Clinic, Cleveland Clinic. So some of the top teaching urology schools have this now, and we're seeing some wonderful results.
Still thinking about the testicles. So if you're zapping, I don't know a better word, zapping the testicles, I would assume then that's going to probably boost your hormones, testosterone.
Great point. And with just a small sample study, we've seen that just one treatment on the testicles improved testosterone by 75 points.
Whoa.
Now that's just early, and we're hoping to do a larger study, but that was good. There's another device out there. It's called radial shockwave that is more of a mechanical, and it actually damaged the tissue. It's like a little piston that hits, and a lot of chiropractors who are doing men's sexual health were buying this because it's a cheaper device, but you have to put a numbing cream on there and 20 minutes before, and then you use it
That
on.
sounds painful.
That is. So we will, we'd like to put our device against theirs and treat male testicles and see which one, who comes back and who doesn't.
So what were when you have the head
applicator,
it's kicking out acoustic sound waves.
Heat, light, and electrohydraulically produced sound waves. The best way to explain it is it's like taking a lightning bolt and thunder and putting it into an applicator.
Okay.
Because you're getting the light and the heat, but it's really that high pressure, low pressure that comes out during the thunder that creates that movement across the cell membranes. And that's really what it's doing. We're seeing it release the oxidative stresses around the cell membrane and opens up those exosome channels. So now you're able to get nutrients in and waste products out.
Is there any, like if I put it over my other knee that seems fine, is there going to be any damage if there's nothing there?
We don't see any cell damage or tissue damage when run over normal tissue.
Okay.
So in a big study in Europe, they looked at men with erectile dysfunction, and they used this device. In men that didn't have any reaction to Viagra, Cialis, or Levitra, they had a 65% improvement and were able to have sexual relations. So that's on people that were really far gone, that not even those stimulants could help them get a full erection. So, I think of it, if it can help people with ED, that's one disease that a lot of men don't want. And from a pre-ED standpoint, this may be a really nice answer. So to keep your tissue healthy, to keep the blood flowing, to create new blood pathways. So, this is we're using it on so many different type of it seems like every 2 years we're able to reinvent ourselves. I mean, we started with the non-healing fractures about 10 years ago, and then we started the cardiac regenerative tissue, and in the last few years it's been urology and men and women's sexual health. So even women they're using it for coupled therapy now.
Well, in the chronic illness world, I mean, when somebody gets sick or, starts having symptoms, one of the first things that disappears is sex hormones, sex drive. But I'm thinking also on, especially in the testosterone world, I mean, do you do the injections? Do you do the pills? Do you do the, topical? But it's if when somebody starts testosterone therapy, it's kind of like they have to stay on it forever, where this just seems like it gets the body working back to where it needs to without that stuff.
Right. And one of the things we see in early signs of mitochondrial decay is loss of libido. People tend to stay up later. They get the brain fog. All these different things. They just don't have that energy that they used to. So we feel if we can catch people quick enough that we may be able to reverse some of this, as well as proper diet, vitamins, nutrients, exercise. I mean, it's just one of the pieces in the puzzle to keep your body healthy and moving the way it's supposed to.
Wow. I mean, I'm seeing a vision of this is really got to be part of the healthcare of the future. Well, I mean, now, but of course, it's getting more of these devices in every area of the country and around the world so that when you have a need, you can go to somebody that has this machine, because it's about $75,000 for a clinic to purchase one, or somebody to
That's
purchase
right,
one.
for a clinic, and the urology models and the veterinarian are even more.
Okay.
And they have different heads and applicators, which changes it, but the basic technology of the machine is the same. So, I mean, yes.
Where you could have so many treatments if somebody locally has one, or obviously flying to Atlanta, or like yourself or somebody that's got one, you could have so many treatments and not even get to the cost of one regular stem cell treatment. I mean, this is phenomenal.
That's right. And, Isaac is known for his virtual clinics and probably has the largest virtual healthcare system in the country right now. And what we're finding is after he went on Facebook, it was a live streaming event, and our CEO, John Warlick, said it should have been called live screaming because, again, it was painful. He didn't really know how much pain was going to be involved. But, I mean, he literally got off the table and could move his leg. He went from a brace and crutches to a cane and soft brace to where he was sending me videos of, sprinting 5 weeks after this. And it's really incredible.
So depending on, he had a ton of damage to his knee. So it was painful during the therapy, but as soon as you're done, the pain's pretty much gone.
And the cool thing is each subsequent visit, there's less pain. So the patient can actually see the healing process and feel it. So, and Isaac had a deep bone bruise, which is added to the pain that he had, plus all the damaged tissue.
Okay.
But he's done great. And recently, his two-year-old son broke his arm, and they took the cast off so we could treat that part of the fracture. Now, you can't use it on the end plates because it could stop the growth of those end plates, but you can use it on areas of fracture in the midbone.
Just getting a vision of, well, what if, because kids have to go get their physicals before sports. What if the physical was, let's go get a scan on this machine and see if there's any areas? That makes so much more sense than the garbage that people do now.
Think about the series Star Trek, though. I'm going to go back to that because it was so futuristic and, cell phone technology. I mean, we see things in movie and TV, and this is truly one of those devices that they were way ahead of their time. And not only, like we said, does it make the diagnosis, but the healing starts, so we really want to map out an area first. We almost use twice as much of energy and shock waves on that initial treatment to really map out where the damaged areas are.
Where somebody would feel pain.
That's right.
Is damaged area. Mm-hmm. Okay.
So subsequent visits, we can focus the majority of the energy on those damaged joints or tissue.
And is that the benefit backing up to the machines in the hospitals that break up kidney stones? You said they're very focused versus this has a big applicator head so you can cover more distance?
That's right.
Okay.
So unfocused means smaller treatment area, maybe like the size of the dime. So you'll have to use twice as much time with those lower cost radio mechanical devices, where ours is about the size of a coaster for a cup. And so it takes us 3 minutes to do a patient's foot on each side. So it doesn't take long. The patients love the results. And we're really starting to get into this new, arena.
It's cool stuff. It's really awesome things. As we wrap up the interview, Dr. Matt, is there any final words you have for the listener or any concepts that maybe I didn't ask. I just kind of let my mind race about all these different questions that I personally have about it. But
I'm very appreciative that you were able to see my vision, and thanks to Isaac Jones for connecting us, because I do feel that this is the future of healthcare and that we do need one of these in every city. Mm-hmm. You know, Ray Kroc, you remember, he was the guy, the developer of McDonald's. Mm-hmm. And if you read his book, he saw the first McDonald's franchise and he thought, wow, we need one of these in every city in America. And that was 55 years ago. Look what it's done to our society and how we now have this weight issue and people eating fast foods, and you're seeing it spread to different continents now. I really look at this as the type of device that truly is transformational, meaning a lot of therapies that we use in our offices get incremental changes. This is truly transformational. It helps your body jumpstart that healing process and really accelerates the whole process.
Wow. And Isaac's son that broke the arm, I mean, what, maybe 14 months old?
18, 16 months, I believe, yeah.
So, I mean, little guy.
I mean, we can use it on young people. Not that we treat a lot of young children, but we really can see the versatility of this device. And again, using it on bone, tissue, cardiac tissue, nerves. I mean, that's exciting. How many devices can say they hold a patent for peripheral nerve regeneration?
I don't know any other than...
They should Google it.
Yours. So, what about applying it to your head? Is there any areas of the body where it's like, stay away from?
Well, you know, for years we kept away from the eyes and the testicles and also the lungs. For some reason, we're not really sure how the sound waves will work in empty air. So we do stay away from some of the apices of the lungs. But, you know, in Europe, they are using some early studies even on Alzheimer's patients. So that is a new frontier.
And is that applying right to the brain?
That's
then?
correct.
Okay.
And think about it. Alzheimer's is amyloid plaque in the brain. And if we can utilize this technology and find the right energy, and the biggest hurdle is getting through the skull, the thickness of the skull, but you will have this reverberating effect. Like, how do you find a fracture? With a tuning fork, right? You put it right on that area and it vibrates to the point of pain. Well, this creates that vibrational effect and that with the sound waves to look for that damaged tissue.
And essentially it's working, just going back to the like cellular level. So when there's a damaged cell, it's going to act somehow like tell the membrane of the cell, hey, you're damaged, and start healing, but yet it's not going to actually damage anything around it.
Well, I mean, in chronic disease is really the loss of communication between the cells. Mm-hmm. And this is a true communication link between the cells, and it's an attractant. It's calling for all these other helper cells to come to that area. It's almost like tricking the body into thinking there's a new injury. So that's the process that we like. And getting that body working at that higher, more optimal level is really what everyone's looking for.
Interesting. Do you think on the stem cell injection side that stem cell injections would actually be more effective if it's an acute injury than chronic in the healing process?
I mean, I look
just seeming like this can do acute, chronic, like everything in between.
I look at one of the big pilot studies that's come out of Austria. They now have one of these stem cell machines in every trauma center in Austria. So they have 11 different centers. And for every spinal cord injury in Austria, they have this device done within 72 hours. It's just a protocol that went into effect in July of 2018.
Okay.
And just in the early studies, they've seen a 50% reduction in paralysis. Now, it's not because the spinal cord is injured and we're, repairing that. It's actually that we're getting the inflammation out. Inflammation is what causes that paralysis. So inflammation is really the silent killer. Plaque within your arteries is not from too much cholesterol. If that was the case, Alaskans would have the highest rate of heart disease. So the plaque is coming from inflammation. And that's why we think that this will be wonderful once we get the cardiac regeneration technology in place. It's not here in the United States yet, but can you imagine using this type of technology to break down that plaque?
That's awesome.
Or stop it from ever creating.
Yeah. So you've got you call it the stem cell machine producer. You've got you call it the inflammation killer.
The Star Trek scanner. I mean, it is a very futuristic device, and so exciting times to be in healthcare and bringing some of these less invasive devices to our patients and our communities. When you get back to stem cells, yeah, I do think that stem cells and exosomes have their place and could be wonderful, but are they readily available? They're not in ORs, they're not in ERs. We are seeing doctors use this device right in the OR. So it helps repair that tissue and you have less scarring. We have plastic surgeons that are using it. We have a doctor in Atlanta, he's been using it since July, and he's had over a 70% reduction in his opioid prescription writing.
Wow.
So this has the ability to really help us in this fight against this opioid epidemic. And most people, unfortunately, have been taught to go to the medicine cabinet when they have an ache or pain, pull out some aspirin or Tylenol, and take it to relieve their pain. This is a way of really pinpointing and finding the direct source of pain. So we're most excited about helping fight against this opioid epidemic. And as you know, prescription drugs are a terrible epidemic. We're losing over 1,000 people per week in this country. And we are losing the fight, the war on the drugs. We're losing it. And you look at the aviation industry. They've had one death in the last 9 years. They will change their whole industry and protocol to save one life. Why, in medicine, is it okay for us to lose 1,000 of our citizens per week? Right? If you look at some of the numbers, 70% of all prescription drugs in the United States are consumed by the United States. And we're only 4% of the population. 80% of hydrocodone is consumed by the United States. And now I just saw 90% of OxyContin are consumed by the United States. Our healthcare system is broken, and we need something like this device that can help really pinpoint and find the true source of that pain, not only find it, but then activate that healing response and bring out that natural innate ability in our own bodies.
Get the stem cells going.
Yes, sir.
Well, I hope you enjoyed this interview with Dr. Matt Doduro. And just so listener knows, he literally modified his travel schedule to get here because I was so excited about this really revolution in the healthcare system, and he was kind enough to be able to get here. What's the best way for people to get in touch with you?
Well, we have our own podcast and YouTube series called freemypainnow.com. Okay. And on there, we also show case studies of patients because people are not going to believe it. We've actually, for the last 2 years, started to videotape patients with their list of issues because 2 days, 2 weeks, 2 months later, they're gone. And we're able to really follow that patient on a journey. So we have our clinic called ATL Pain Institute in Atlanta that we see patients at, but we're actually working with people all over the country and helping them find a center that's close to them.
Awesome. What was the podcast website?
freemypainnow.com.
freemypainnow.com. Well, thank you so much for sharing the technology and all the details about it. Hope y'all enjoyed this interview. Make sure to share it with your friends and family and your practitioners, healthcare professionals. We need to really change the healthcare system, and this has the ability to do that. This is Dr. Jay Davidson. Maximum blessings.